Everybody joining us. We'll just give it a few seconds for people to join us. Okay, so we'll get started. If other people join us as we go through that, that's absolutely fine. So just like to welcome everybody to our careers webinar. We'll be focusing today on three particular professions, which is occupational therapy, podiatry and diagnostic radiography. So just to introduce myself, my name is Janet Folland and I'm an occupational therapist by profession, and I'm currently working across the North East and North Cumbria to support the range of professions that together collaboratively are known as the allied health professions. Can you move to the next slide, please, Paul? So what we'd like to cover today, so in today's webinar, we'll be joined by a range of colleagues to explain more about allied health professions, where we work and what we do. And in particular, we'd like to provide you some information on how you can become one of our very valued allied health professions. And then we'll be moving on to looking at the three particular professions, as we said: occupational therapy, podiatry and diagnostic radiography, where you'll be able to find out a lot more about those particular professions. There'll be plenty of opportunity to ask questions, and we very much welcome any questions that you may have. Can we ask that you put it into the chat as we go along? Can I apologise to anyone who can hear anything? There might be some rustling in the background. I have a puppy that insists on being underneath my desk and chewing up things. So any rustling you hear, my apologies. But just going back to a question, so there will be opportunity to ask questions at the end, but any questions you have going along, please just put them into the chat and we'll make sure that we cover them at the end. So you can move on to the next slide, please, Paul. So where do allied health professions work? So as you can see from a map, this is a map of the North East and North Cumbria, and that's because this webinar today is brought to you by a collaboration or a partnership of organisations working right across this area. So wherever you are on this map, we have AHPs working. And wherever you'll be surrounded by a whole range of different services and organisations where you can find AHPs in all their different variations. The most well-known of and the largest provider of services, of course, is the NHS. And within the NHS, we cover such an enormous range of services where you will find AHPs working, including acute emergency services, specialist services such as stroke or respiratory. You'll hear a little bit more about that a bit later on, as well as some of our diagnostic services and across a range of rehabilitation, mental health and children's services. You'll find those within the NHS and a lot more where you'll find the different allied health professions. We're also found across social services and community services, schools, prisons, care homes and GP surgeries. So basically wherever there are people across our communities who need health and care services, you will find allied health professions. So on to the next slide, please. So who are the allied health professions? We are a very proud group of 15 different professional groups. I don't know whether you can see on that slide, there's all the avatars, the people there with the names of the different professions underneath. So all of those come under the banner of allied health professions. The range of scope of professions is hugely diverse. And as I said in the previous slide, we cover the whole range of health and social care settings. We are the third biggest workforce in the NHS after doctors and nurses, but probably not so well known, particularly some of our smaller professions. We are professionally registered with the Healthcare Professions Council, and we work as autonomous practitioners within each of our chosen professions and also within each of our professional professions. So each of those that you see on the screen, there is a very dedicated support workforce who work with us, alongside us. And again, you'll be hearing from some of those today. So if we can move over onto the next slide, please, and I'll hand over to Alison.
Thank you very much, Janet. Hi everyone, so I'm Alison Kerr, I'm the AHP Workforce Lead at South Tees in Middlesbrough, and I'm a therapeutic radiographer by background. So we're going to go through a little bit about the routes into the professions. So you can come into the professions quite a few ways, which might not have really been advertised when you're at school and things like that. So you can come in as a band 2 support worker, or a band 3 support worker, or a band 4, depending on your experience and what levels of qualifications you've got. So there's the opportunities to come in. The NHS works from band 1 all the way up to band 9, all depending on experience and roles and responsibilities. So there's different areas there that'll show the different qualifications. Once you're in those roles as well, we have like a level 3 and level 5 apprenticeship program, so you can progress in those roles if you want to. And we also offer a level 6 degree apprenticeship, which we have quite a few of our colleagues have gone onto that program from being a support worker within the set professions and gone to study in the apprenticeship, where they work within the role, within the hospital setting or the community setting, and then at the end of their course they will get registered with the HCPC and work as a band 5. We've also got the university route as well, where you'd go to university and you have a place, like a placement base at a certain area. You'd get some hands-on experience, but also be at university and doing that level of education. Once qualifying, usually after about 3 years, sometimes it's 4 years, you'd come out with a Bachelor of Science degree, and then you'd get registered with the Healthcare Profession Council, like Janet mentioned, and then hopefully go into a band 5 role. There is another route as well. So if you've already got a degree in a science, there is some routes to go in through a master's route, which is a 2-year course, and you'd come out with a master's degree within a said profession. Now, all of the professions, as Janet's mentioned, there's 15. They all have kind of different criteria depending on what universities you're looking at and what area you want to work. So it's good to check on the HEIs, which are the Higher Education Institutes, to see what they require for different courses. But it's very important as well, I'll just stress this point about having the experience of either working in an NHS setting or in a hospital setting, either paid or unpaid, just to get that work experience. It just really helps you with your CV. Could you go on to the next slide, please? So today, I'm proud to announce that we have some fantastic speakers, and we're covering 3 fantastic allied health professions today. So we're going to start with our occupational therapists, move on to our podiatrists, and then our diagnostic radiographers. If you move on to the next slide, please, Paul. So I'm going to now hand over to Helen, Caitlin, Ashley and Sarah for you to talk through your slides, and we'll be eagerly listening to your story and very excited to hear what you've got to say. Thank you.
Hello everyone. Could you go to the next slide, please? Cheers. So hi everyone. My name's Helen, this is Caitlin, and we're just going to do a bit of an overview of what occupational therapy is, where we are, and then we'll go into a bit more detail about our service. We'll keep you in suspense for what that is. So occupational therapists work with people to help them take part in what they want and need to do. And then this may include adapting the way that they do those things. Occupations to us are the activities that you enjoy or find meaningful or simply want or need to do. I think often we get mixed up with occupational health. So if an activity is important or meaningful to someone, we'll try any kind of which way to support them to do it. So, for example, if someone was struggling with their mobility and using the stairs, they might find a stair lift useful. Or if someone was experiencing anxiety accessing the community, they might find it useful to have support with confidence building. So that's just 2 small examples. So who do we work with? We work with any patient group across the lifespan, adults, older adults, children. So, for example, we could work with people with learning disabilities, people that have suffered strokes or brain injuries, people that mobilise using wheelchairs, and many, many more. Within that, we'll also collaborate with the people's families, carers, and our other allied health professions, and third sector like social workers. So, yeah.
So places that occupational therapists can work. A career in OT provides a wide variety of possibilities and many wonderful places to work within mental health and physical health settings. Some of the places that OTs can work can include mainstream and special educational needs schools, within people's homes, in community settings such as at Child Development Centre, within care homes. OTs can also work in prisons, in GP surgeries and in social care settings, as well as in the NHS and in private organisations. So as you can see, there's lots of different possibilities there. The settings that we work in, I mean, there's many that we've just mentioned there, but the settings you'll be hearing from today. So Helen and I both work in older adults mental health, memory and later life service. And we'll also be hearing from others that work in acute NHS hospitals, at Gateshead Health and Northumbria Healthcare NHS Foundation Trusts. Prospects for progression as an OT. Often as a newly qualified practitioner, as mentioned previously, which will be a band 5 when you qualify, within the NHS you'll be offered most of the time a preceptorship. This is a period of around a year where you'll be supported to transition into your new role with some additional supervision and some joint working. There is a similar scheme as well within some social care settings, such as at Cumberland Council, which is called an Assessed and Supported Year in Employment, or an ASYE, which again just provides you with that supported progression into your newly qualified role. Other roles available within the NHS as you progress include a senior or a specialist OT role, which is generally band 6, potentially a clinical lead occupational therapist, or positions with more of a managerial responsibility, such as a team leader, which will be around band 7. And OTs can also progress even further to work in specialist AHP roles, which can be band 8 and above.
So what type of activities make up a typical day for our role? Well, it can be different across settings, but generally we follow the OT process, it's called. We start with initial assessments where we get to know patients' backgrounds and gather as much information as we can. We generally look at the person's routine, habits, roles, and then if there's anything we feel like we've missed out, we can do further assessments like a community assessment or functional assessments. OTs can also host therapeutic groups so you could run a group for like people that have suffered strokes and make it more of like a general thing rather than honing on one person. And we can deliver individual therapy sessions. We prescribe equipment as well, don't we? And write up reports and complete risk assessments. The list is endless, but what do we love most about our role? Every day is different. You see somebody different every day, and obviously their needs are different. We love helping people engage in what's meaningful to them. We build therapeutic relationships with patients and their families. We advocate for patients. And we enjoy mentoring students. We'll often have an OT student with us, and we enjoy supporting their development because we know what that's like. And we get great opportunities for training and development within our trust. Are we on the next slide now? Next slide, please. So this slide is specific to Caitlin and I's role within the Memory and Later Life Service. So we're both band 5 OTs working in the East Cumbria team. So some of our team works in Carlisle and some are based in Penrith. We are a community mental health team for older adults. So we support people with new or already established dementia diagnoses and people who are experiencing things like anxiety, depression or psychosis. Our team is a multidisciplinary team, including mental health nurses, clinical psychologists, clinical support workers, specialist doctors, consultants, assistant practitioners. And within our team, we have 3 pathways. So we've got the early memory pathway, who support people who have just started experiencing memory difficulties, and they may receive a diagnosis and start some medication. Then we've got the complex pathway that supports people who are experiencing multiple health difficulties that are affecting their memory or mental health. For example, they might be experiencing hallucinations or have a diagnosis of Parkinson's. And we also have the Care Home Education and Support Service, also known as the CHAS team. And they support people similarly, but in care homes.
So we both got into the occupational therapy profession after completing an MSc, which is a Master of Science degree. So we had both previously completed undergraduate degrees in different fields, myself in early years education and Helen in psychology. But after spending some time in the workforce, we realised for various reasons that we wanted to retrain. I was working in a special educational needs school, and I actually worked alongside an occupational therapist, and I was really inspired by how she was able to support the students individually and really make a difference to their experience at school in a person-centred way. So I did some work experience with her and then made the decision to go back to university and retrain to be an OT myself. Helen, I'm sure you won't mind me saying, Helen worked within a car manufacturer for a few years and completed her psychology degree, and then took some voluntary redundancy, took a break to spend some time with your little girl. And then after thinking about some different career paths, shadowed an OT who worked in adult social care, which inspired her to also take the plunge and retrain as an OT as well.
So, a typical day as an OT in our service. Well, we have allocation meetings each week where we discuss new referrals. They usually come from within our team, but sometimes come from the GP, don't they? So we'll discuss the referral among our group of OTs. We'll discuss any key information that jumps out, any ideas that we have, and then decide how urgently we need to see the patient. So when we've picked up a new referral, we make an appointment to conduct an initial assessment. And again, we gather as much information as we can about routines, roles, interests, mobility. And then we work with the patient to set some goals and then design therapeutic intervention sessions that work towards reaching that goal.
So an example of a successful therapeutic intervention that I've actually been part of was to help in supporting a gentleman who had previously been a really keen cyclist and to keep taking part in cycling because it was such a meaningful activity for him. He had unfortunately lost the ability to engage in it safely due to some mobility issues and cognitive issues. And there was concerns around his ability to be safe on the road. So after an initial assessment, we jointly set a goal for him to be able to safely take part by joining a local accessible nature reserve using an adapted bike. So this was a lot safer for him because it's pedestrian only, so there's no risk from traffic. And after we went there together for me to assess him using the equipment, we found he was able to either use a tandem bike with another adult or to use an adapted adult tricycle. And this gentleman actually then continued to go there once a week for many, many months. So that was successful in extending his participation in a really important activity for him, which also increased his well-being and helped promote his independence at the same time.
So we can also, as I say, prescribe equipment to patients. For example, if someone's struggling to get up from the toilet, we might discuss provision of a toilet frame or a raised toilet seat. Or if someone's struggling to stand up for the duration of a shower, we would prescribe a shower chair, and that person would be able to continue to shower independently and safely. We can also offer advice on handy gadgets that make life a bit easier. So if you have a look on the slide there, there's a photo of like a little yellow thing called a liquid level. That's a device that supports people with deteriorating eyesight, and it beeps when the water reaches a certain point, so that will prevent spillages and burns. And there's also a photo of a kettle tipper, which supports people that can no longer have the strength or coordination to lift or guide the kettle safely to the cup. So it tilts on an axis guided to the cup. And that allows the patient to continue to make and enjoy hot drinks. And as with every job, there is a bit of boring admin, but this is just like your travel expenses, booking appointments, and replying to emails. But I would honestly say that's the only boring bit about our job.
Another big part of our role is to plan and facilitate therapeutic groups alongside other OTs. So our service offers patients the opportunity to take part in a course called Recovery Through Activity on a referral basis. So this course is an evidence-based programme delivered globally by OTs. We deliver it to a small group of participants, and we aim to reintroduce meaningful activity to them by working on increasing their confidence and motivation, adapting tasks and responsibilities, encouraging some discussion between people who are experiencing similar difficulties, signposting to local support and provision. So each week will have a different theme, such as creative, outdoor, self-care or leisure, and we'll plan some practical activities for them to take part in. So we've previously led activities around gardening, painting, crafts, board games, and we've also had local providers come in to lead sessions. And we've had people come in to deliver chair exercises, guided meditation and poetry sessions in the past. So hopefully this has been an insightful view into what a day as an OT in our service might look like. It's different every day and it's difficult to fit it all on one slide. So thank you very much for listening, and we'll now pass you over to Ashley, who's going to talk you through his career journey.
Hi, so I'm Ashley. I'm a Band 5 occupational therapist at Gateshead Hospital. I thought what I would do is something a little bit different. I would talk about my journey to becoming an occupational therapist. I wasn't sure when I left school what I wanted to do. My friend at the time was in healthcare and he said, why don't I come and join? He worked with the physios at the time. So I joined as a Band 2, where I was supporting physiotherapists and occupational therapists, following their plans, ordering equipment, and just kind of doing day-to-day tasks on the wards to support the physios and OTs. I then progressed onto a Band 3, which gave me slightly more responsibilities. And then I started to work more closely with the occupational therapists at this point and thought, this is something I really want to engage in. I then went over to a Band 4 practitioner, where I started, having my own little caseload, working just with occupational therapists at the time. I then started my degree, and worked 3 years to do my degree until I qualified this year. So I'm only a newly qualified Band 5, and I've started on a rotation now. So as a Band 5, I'm on a rotational placement at the moment. So every 6 months I go somewhere else. At the moment, I'm on a medical ward. So in a day in the life of a medical ward is every morning we have an MDT with doctors, nurses, consultants. We discuss every patient that's on our ward. We talk about sort of discharge plans, what the doctors feel are sort of our goals for each patient, how long they're going to be involved in the hospital for, and then they discuss whether the patients will have any occupational therapy or physio needs. It'll be down to myself or the ward physio to go and meet with these patients. Very similar to the previous slide, we do our initial assessment, we engage, get all the information, collateral history that we can get from them, work with family to discuss if there are any problems, how things were going on at home. We then work with doctors to establish how long they're going to be in hospital, because very, very often doctors will refer to occupational therapy when they're sort of nearing discharge, point of discharge. We will come in and do our assessments and get someone back to the point that they are safe for home. And then we'll follow up with community teams, just because in an acute setting, our caseload is quite large. So we often will deliver equipment. We will do home visits, environmental visits for then the community team, which is a different service outside of our trust, will then follow the patient up at home where they can do the therapy goals. They can get them back rehabilitated and hopefully living a more independent life. For me, my goal is to continue as a rotational Band 5 for a couple of years, get some training in different fields, whether that be stroke, mental health, care of the elderly. And past that, I haven't decided where I want to go. I could progress to a senior. I could stay as a Band 5. I could progress to being a team leader. I could work in research if I wanted to go down that route, or go into teaching in universities. So I think with occupational therapy, well, in all AHP roles, I think the scope of where we can go in our career is amazing, and I would push anyone to look more into it if you can. And yeah, it was just a whirlwind tour of an occupational therapy from an acute setting. So yeah, I'll pass you on to the next person now.
Thank you. Hi, I'm Sarah, and I thought I would talk you through my career journey, because mine is a little bit different in that I'm not a registered OT. I'm a support worker, but I've still kind of got quite a reasonable career journey through support work. So I initially started with the local authority, my local authority, North Tyneside Council, when I'd finished college, and that was within a nursery setting. Worked with children from the age of 0 to 14. I And this was my first little glimpse at children with additional needs that needed additional support from outside agencies, such as our AHPs. And within that, I got the chance to work alongside physios, OTs and speech and language therapists, supporting the children on those therapy goals, but within that childcare and educational setting. I then moved into a special school and worked much more closely with the therapy team within the special school. And that's where I really got to work closely alongside the OTs, and really thought I like this a lot, and really wanted to focus more on that one area. So got the opportunity to join Northumbria Healthcare as a children's occupational therapy technical instructor, so part of the support workforce within that community children's OT setting. That was a band 3, so entry level support worker role for our service. After doing that for a few years, our trust did introduce the OT apprenticeship, so that was an opportunity that was there for me. But there was also an opportunity to go on a band 4 secondment, which was more of a leadership. It was to step outside of my clinical role, and I chose to do that for varied reasons. Just chose not to go down the OT and become a registered OT route. Wanted to remain as a support worker, which is where I moved into the support worker lead role. And that's actually given me a little bit of leadership and allowing me to support a range of services and support workers within all of the professions we have within our healthcare trust. And within the last, just within the last month, been very fortunate to get a further career opportunity as a band 5. Very unusual because this is still as a support work role, and generally within healthcare, once you're band 5, you've usually got a registered qualification. But very lucky that North East and North Cumbria region have put out this support worker band 5 opportunity to do a clinical fellowship post and work more closely regionally to support our support workers. So yeah, that's just a bit whistle stop tour of my support work journey, and some cool pictures at the bottom to show that the fun and exciting things that we can get up to.
Oh, can we move on to the next slide? So thank you everyone for speaking on that OT section. That was absolutely fantastic to hear everyone's stories and your pathways, and it's great. It's great to hear about everything you're doing. I like the picture at the bottom. This shows us a little bit of fun, because we do have a little bit of fun at work sometimes, don't we? So we're going to move over now to our podiatry teams. So we've got Emma and Stacey, who's going to take over and talk to us about what it's like working in podiatry.
Hi, my name's Emma and I'm a band 5 podiatrist at the minute. I'm working on a band 6 progression role. At the minute, podiatrists work here, there and everywhere, in the community, in hospitals, in GP practices, care homes, but also have the opportunity for private practice as long as they're registered. We can either work together as a team, which we work really closely, but we do a lot of independent solo working out on home visits and alike. We work very closely with our podiatry assistants and other healthcare providers, such as the district nurses, OTs and the like, to help people within the community. And likewise, we do enter into the acute trusts as well. You have the opportunity to also run your own business if you decide to go into private practice. Obviously, big advocate for NHS, chose to come out of private sector myself. We used to go into the prisons. Again, that is something that we're looking to continue, but it is down to themselves, and everything is going kind of privatised at the minute, but we're working on it. New graduates work through the bandings of the NHS, starting as a band 4 when they've just graduated before they get their registration, and there's a lot of help and support to go through the process. Progress into the band 5 role, which again, like the OTs, is a preceptorship role of roughly a year, where the support never disappears and you're put into working a lot more with other professions at least once a month to try and get used to what they do, how you can help them, and working together to try and create those links so that you're not left on your own when you do enter into the community. Our typical work, the big one that we're known for is foot ulcers and saving feet. We do a lot of preventative work to ensure that we can save the feet before they go to the amputation stage. And this can include taking off hard skin, removing ingrown toenails, or providing weekly redressings and working with the vascular team to improve their circulation. But likewise, some people we can't save everything, and we do work a lot if people have had amputations or preventing further amputations and working with them to prevent other problems. There's also the other sides of podiatry, which is the biomechanics, which is the way people walk, assessing them, helping with insoles and exercises to try and get the positioning a bit more correct and to prevent any further aches, pains, muscle problems, any further injuries that can occur. We work very closely with our patients and we do get to know them very well, sometimes too well. They do tend to stay with us for quite a long time before we're able to safely release them on their own with lots of education, and likewise working with other sectors such as the district nurses. We do a lot of joint visits out in community and home visits to support both the district nurses, and that obviously works two ways. No 2 days are the same, and I think that's probably the best thing about podiatry is you can go from taking some hard skin off one day to somebody's foot unfortunately being at risk and admitting into hospital, or doing nail surgery, which is my personal favourite, which is if people have got ingrown toenails with infections, is taking the toenail off, preventing it from regrowing and preventing that further pain and infection and managing them along their journey to healing and becoming happier.
Thanks, Emma. Next slide, please, Paul. So my name's Stacey. I started out as a podiatry admin, which I still do, but over the 2 years I've been with NCIC, I now do 2 days podiatry assistant. So before I go on to the slide, it just shows you that you can, the way you enter into podiatry can take on many forms. I know feet can put a lot of people off, and I never realised that I wanted to do feet. It was just an admin role, but now I'm doing 2 days a week, and it's so interesting. Who knows, you know, where I'm going to go on to. So the slide we've got here is Ivy's story. So she's a 4th year podiatry student, and she's from Huddersfield. So we predominantly take students from wherever really, but Salford and Durham, but Ivy came to us. So here you can see that she has just done a few bits here. So her best bits are the variety podiatry offers, general care, wound care, nail surgery, MSK. So Ivy's particularly interested in wound care and would like to complete additional part-time masters in tissue viability to enhance my scope of practice. So being a podiatrist can lead you on to many things. As OT said, it's not just about the feet, it can be tissue viability, it can be vascular. There are lots of different sectors that you can get into. So why did Ivy want to become a podiatrist? So she wanted to help people. Podiatry was appealing for 2 main reasons. There is a variety of different areas you can work in. So as we said, MSK, which again is very related to the biomechanics of how the feet work, wounds and paediatrics. And the working patterns, regular working hours, so there's no really late night or weekends. It is kind of a 9 to 5, but we see so many people in that time frame that we can, you know, we can do a lot. So how did Ivy get into training to be a podiatrist? So she's currently in her 3rd year and final year of a full-time degree at Huddersfield, as I said. She's a mature student and previously completed access to a higher education course in chemistry and biology, and that gave her the required entry qualifications to become to go on to the degree. So what are your future career plans and top tips for others? So if you're interested in podiatry but not sure what it involves, many of the universities have interactive open days or can put you in contact with current students, which is why we're doing this today. It's just to give you an oversight that podiatry is not scary. You don't need to be scared. It takes on many forms, as Emma said. So that's Ivy's story. If we go to the next slide. So this is Claire's story. Now, Claire has been a podiatry assistant for 20 odd years, and she's currently in her second year of a podiatry apprentice. So she had a lot of knowledge, and I think for her, being that little bit older, she was unsure about the podiatry apprenticeship. Was she going to be okay? She's doing an absolutely brilliant job because she works at Penrith with me. So the knowledge that she's gained throughout those 20 years, she's expanding that. She's learning new skills. She gets to work with people. She gets to be hands-on, and she only has 1 day study a week. So I really like this path because you can be hands-on and you can still do the study. So it's given her a great opportunity to train as a podiatrist, which she'd looked into but unable to take part in because of financial and everything. But now, as podiatry, we're offering that apprentice out. Now we've just offered another job opportunity out, and we've had over 40 applications for that, which is brilliant. So we're currently shortlisting for that, and I think that's really great for podiatry because we can struggle because, again, it's feet, not many people take an interest, so it's important that we get those people coming in. So the best part for Claire, going back to Claire's story, is that she passed her first year. Claire won't mind me saying, but she's a bit of a worrier, but she's a really keen learner. So she's into her year 2, and she's actually doing part of a presentation today, so fingers crossed for Claire. She gets regular support from colleagues at the university. The university is actually in Plymouth, so it's quite a way away, but they're online. There is loads of people available to help her. So the biggest thing is, if you want to know more about podiatry, you've got this video now. Go online, do a bit of research, because when I applied for admin, I didn't really know much about podiatry, and 2 years down the line, I know a lot more than I ever did. So there are a variety of ways you can get into podiatry, whether it be a degree, whether it be an apprenticeship. We really love it, don't we, Emma?
Absolutely.
So yeah, so thank you very much. Any questions, let us know.
Move on to the next slide, please, Paul. Yeah, again, brilliant. Thank you very much. It's lovely to hear everyone so passionate about the professions, and I know because I see it when I'm working with all the different AHPs, it's absolutely fantastic. So thank you very much for showing the different pathways as well. It's very important to understand those different routes. So last but not least, we've got our diagnostic radiographers. So I'll hand over to Angela and Alex and Jordan, and they're going to share their stories about working in radiology. Thank you.
Can we have the next slide, please? Hello, everyone. My name's Angela. I'm a diagnostic radiographer, and I've been doing this for 35 years, so quite a while. But I absolutely love my job. I've sort of worked from a band 5 up to band 7, and for the last few years I've been looking after the students. So we get a lot of student radiographers coming through our department, and I'm the one that sort of helps train them, helps support them, teach them about radiation safety. So that's what I do. But what I'm going to talk about at the minute is what the band 5 radiographer that's starting off at the bottom comes in at. So diagnostic radiographers work with a range of health professionals. So they can work with radiologists. Radiologists are doctors that have specialised in radiology, so specialised in image interpretation, diagnosing pathologies, fractures. They work with a lot of gastrointestinal, looking at the GI system. They do a lot of tests on that. They work with CT. We also work with surgeons, so we go into theatre. If you fall and hurt yourself and you need to, you have an initial x-ray, but then you need to go to theatre to get a plate or a pin put in or a replacement of a hip or a knee, then we quite often go into theatre and we work with a surgeon in theatre with a machine in there. We also work with nurses and support workers. where can we work? So mainly we work in the NHS in our own X-ray departments, but there's also the private sector. Again, we work in theatres. We can go out onto the wards doing mobile X-rays, so we can do chest X-rays on the wards. And there's also some community diagnostic centres that are starting to bring out around the area. So there's some opening up next year in the Metro Centre in Gateshead. So we've got a big CT scanner going in there and an MRI scanner. So we need a lot of staff to man that. In terms of what we do, we have to be very mindful about every X-ray we take is all about we're giving radiation to patients. So there's a lot of teaching around radiation safety and how to keep that radiation as low as we can for every single patient that we see. So that's quite an important part of our learning. In terms of our progression, there are tons of opportunities for career progression. I'm going to start off from a band 5. You tend to do the day-to-day basics. So you work in A&E or you X-ray patients that have come in from the GP or from outpatients, so maybe fracture clinic, patients that have got maybe chest infections, or you might go to theatre. And you tend to do all that as a band 5. You also work quite long hours, so you can work 7.5-hour days, you can work 12-hour days, you can work night shifts and weekends because the radiology department is open the whole day through, 24/7 we're open, 52 weeks a year. You can also go on to specialise in CT, MRI, ultrasound. You can report on the X-rays because there's currently a massive shortage of radiologists. So the radiographers are doing career progression and they're starting to do image interpretation. So currently at the QV, we've got 10 radiographers actually report the images. Or you can go into research or education. You can be a lecturer at the university, or you can be a practice educator on site with the students. So there's lots and lots of different opportunities, something that would suit loads of different people depending on which route you want to go down. In terms of a typical day, we work as a team. We're always working as a big team. So it's about supporting each other, helping each other, communicating with each other, making sure we get through the day together. It's about producing good quality X-rays. So we help diagnose fractures or diseases. That is basically what we are doing. We're trying to determine whether a patient who's had an injury has fractured one of their bones or has got a pathology, has got a chest infection, and that will determine their treatment, what happens in the future. We also help the doctors by putting little marks on our X-rays if we spot a fracture. So we're sort of trained to help identify different fractures and pathologies, and then we can identify that for the doctors so they can pick it up just in case they don't happen to see it. We try and provide the best care possible with our patients. Our patients are with us only for 5-10 minutes at a time. So it's trying to give that patient the best experience possible in that tiny little space of time, because quite often we won't get to see them again. The only time they tend to come back is if they've maybe been to theatre, and if they've broken a hip or a leg and they've been to theatre, had some pins or plates put in, and then they keep coming back to us for X-rays subsequently, few months down the line to check how it's progressing and make sure it's okay. That's about the only time that we see our patients again. We also supervise students of all different levels, which we're going to talk about in a minute. And we work with other health professionals as well. What do I love most about my role, or the band 5? Our team, we have got a lovely, friendly and supportive team. It's all about teamwork in radiology and working well together. It's very fast paced. If you like a job that's a sit down job, diagnostic radiography is not for you. It is very fast. We're getting our patients in and out every few minutes, and it's very hands-on. Not boring at all. Well, I don't find it boring. No two patients are the same. They all need different types of x-rays. They all need different care. We work with pediatrics, so children, adults, patients with learning difficulties or learning disabilities. It's just a great job. It's really a really great job. And we've got a national shortage, and a national shortage across the whole of the country, so we are desperate for radiographers. When you qualify, you've got the option probably to work in whatever hospital you like, because everybody can't wait to get their hands on you. So that's what diagnostic radiography is about taking x-rays. But I'm going to pass you on to Alex, who's our third year radiography student, who's almost completing his course. So can we change the slide, please?
Just trying to get in there. So, hello there, my name's Alex. I'm a third year diagnostic radiography student. I used to be a former mechanical engineer working in the oil and gas industry. But after COVID, like so many people, I lost my job and I decided that I wanted a new challenge in life. I came across Teesside University's perspective for diagnostic radiography, where they were hinting on that engineers had gone into this role because of the advanced technology that you get to work with, and that quite appealed to me because you also get to help people. As Angela's mentioned, I take x-rays in a range of different settings, so from A&E, theatre, GP clinics. These images are all required for doctors to diagnose patients for illnesses. We've also got to vet x-rays, so if you ever get a request from a GP or a surgeon or a ward doctor, you have to make sure that that request is justified, because like Angela's mentioned, we're working with ionizing radiation, and we have to make sure that the radiation the patient's going to get is actually going to answer that clinical question. You can be amazed sometimes the requests you get, and they've asked for the wrong modality. So if they're asking for sort of soft tissue nerves, that's for MRI. You wouldn't be able to see that on plain film. The best bits about the job is the diversity of the workload. So if you've got like a GP knee clinic day, you can be up and down assessing patients' knees. Or if you've got a really busy day in A&E, you can have so many patients coming in for so many different types of things, from dog bites, where you're trying to see if there's a potential tooth lodged in their arm or something like that. If somebody's tripped and fell over and they're querying an ankle injury. Then, of course, you've got the critical care department. So if there's a patient in there who is too sick to come to the department, we'll then go across with our mobile x-ray to see what's going on, so that the doctors can then put a plan in place for their next stage in their care. How did I go about getting into it? So as a mature student, I went through an access course at Sunderland College. It was a one-year course, which gave me the qualifications the same level, equivalent to like A levels. I think it's like 120 credits you need, so you need like 4 distinctions and 1 merit. After that, I've then undertaken the 3-year degree, where I've learned extensive anatomy knowledge, physics, X-ray science and technology. You learn a lot about professionalism within the healthcare. We're recently doing suspected physical abuse, like the signs you need to look forward to. So this week I'm actually on a PEEP week, where we're doing sort of like forensic radiography. So if you have a child come in with suspected physical abuse, we would need to do a skeletal survey. So you take a range of x-rays, which would then potentially go to court, and you would have to go to the court and be quizzed on the images that you've taken. So you've got to be able to make sure that those images are acceptable evidence to be used. So that's quite an interesting scope you can go into. Of course, you can actually become a forensic radiographer, where you perform post-mortem, if that's what you wanted to go down to. My future career plans, haven't totally decided. So as Angela mentioned, you can do CT, MRI, ultrasound, or reporting. MRI appeals to me because I quite like the physics side of radiography, but I also quite like the reporting side. But it depends whether or not I want to do another 2-year degree. Maybe not. Maybe I have to stick to MRI. Yeah. It is a really good profession. The staff here at the QE are really, really professional and really helpful. There's plenty of avenues to do additional training. Yeah, it is a really great place to work. It's a really great profession to get into. That's it from me. Thank you.
Can we go on to the next slide, please? Thank you. So Jordan can't be with us today, so I'm going to talk about Jordan. Jordan is one of our secondary assistant practitioners. He was a radiology support worker with us for quite a few years. Wait, like he's just going to say hello. Or is he not? No, he's not. He's been with us a few years and he decided to take on this apprenticeship course, which was offered to him. Previous to him, we'd had a couple go through the apprenticeship route and they've really enjoyed it. The good thing about doing it is within the department was they become very familiar with how the departments run. They know what the staff are like. They become a really good part of the team. They know how the patient goes through the system. So about picking the patients up at the start, about getting them changed, communicating with them, giving them a good experience. He was familiar with all of that and decided to progress down the apprenticeship route. So Jordan has done this. He was a band 2 before. I think next month he completes his exams. So he will have finished his second year assistant practitioner through the apprentice route, and he will become an assistant practitioner at band 4 level. He's going to work with us maybe for about 9 months to a year, and then hopefully he's going to progress and do another apprenticeship to become a band 5, and then he'll be a fully qualified diagnostic radiographer. So what's Jordan got to say? What has been the best part of your apprenticeship? And Jordan says, gaining the knowledge and independence which I can then use in the journey of patient care, knowing that my contribution can help with their well-being. He's enjoyed learning all the interesting anatomy variants, and that's a really important part of our job. You have to know all the bony anatomy and all the anatomy of the chest, the lungs, the liver, all the different bits. You've got to know all inside out. I think one of the best parts is about adapting what you do for your patients. So some of the patients are a bit trickier than others. They're not as mobile. They can't do what you ask them. They can't just hop up on the table when you want them to. They can't turn on their sides when you want to do a different view for them. So it's about adapting your technique and thinking how you can modify what you do to get the best image for that patient. What has Jordan's proudest achievement been? It's passing all his assignments and exams. But I think he's really proud of the fact his wife and children praise him how far he's come. He's come a fantastic way. Jordan was dyslexic and he's done great. I think he struggled at the start, but he's overcome that. He's done a great job. He's put in the time, the work, the effort, and well done to him. Hopefully he's going to go on to do the band 5. So for anybody that's considering the apprenticeship, an excellent way to progress your career. You don't have the fees from the university at the end of it all. It's for Jordan, it's been a passion of his since he started support work in 2019. If you have got family, I think you need a lot of help and support to get through the course, because you've obviously got other things going on at home, so you are sort of multitasking and trying to fit things in. So it's about putting in a lot of time and effort and being committed to do the role. And he said, if like himself, you're a kinesthetic learner, it's the perfect opportunity. So yeah, that's what radiography is about. So that's me finished as well. Thank you very much for listening. If you've got any questions, just please ask. Thank you.
Thank you, Paul. Next slide, please. So that is sort of come to the end of the presentations and our speakers from Occupational Therapy, Podiatry and Diagnostic Radiography. So thank you, everyone. It's been really fascinating hearing everyone's different sort of journeys into the profession and what everyone's doing. So hopefully it's given you a bit of a flavour of what we can expect for those 3 professions. So if you'd like to explore allied health professions more, there's a really lovely site called Aspiring Allies, which gives you a lot more information on all the different allied health profession roles and careers and the routes into them. You can scan that QR code or visit the link there, which I will put into the chat now, so that you've got access to that. Also on that Aspiring Allies site as well is a quiz, so you can do the quiz and explores with you what AHP role you might be best suited to based on the subjects you study, your skills and your personality. So it's quite a good way, well, sort of quite good fun way really of exploring the different professions. We have got some more information that we can send out to you after this webinar with all the different routes into the different professions more locally. So that will come out afterwards if you are interested in that. So that has really come to the end of the speaking part of our webinar. If you've got any questions, then we'd love to hear them.
Janet, I'll just unmute everybody now, so you should be able to raise your hand if you'd rather ask a question via your microphone, or you can still put things in the chat as well.
Okay. So any questions whilst you've got this captive audience of these occupational therapists, podiatrists and diagnostic radiographers? This is a really good opportunity to snaffle some of their knowledge and ask whatever questions you might have. So a question in the chat there. So can an 18-year-old school leaver go onto a degree apprenticeship? So the answer to that would be yes. Might think of that. I'm sorry, Alison. So you want to come in on that one. A lot of the routes into apprenticeship is often through our organisations, so which would mean sort of getting into one of our organisations, usually the NHS, but not totally the NHS, as a support worker, and then going into an apprenticeship from being a support worker. So there is you probably could, but it's at the moment that's a more unusual route to go straight in as a school leaver. There is some exploration of that as a route, but the more usual route would be to go in as a support worker. And actually going in as a support worker is a really good opportunity to explore whether it's a career you want to do. So I'm an occupational therapist. I work across the professions now, but I'm still a passionate occupational therapist. I started out as a support worker in social services actually, and I would say that's a really good route anyway. Has anyone got anything to add to that at all?
No, I would just agree with what you said, Janet, that it's, when we've opened up the apprenticeships, certainly from my experiences, it's the support workers that have progressed because they've got the wealth of experience to go into applying for those roles, because you'd still apply for it and go through an interview process, and you would have a better chance of having that experience to back you up and going into apprenticeship role, because it is quite a heavy program in terms of you would be working and studying at the same time, so it's nice to have that grounding just to help you through the course.
Yeah, that's it. So next question there is, will the university or applying to apprenticeship will still consider students who came here in UK and did only 2 GCSEs, which is math and English, and did applied science for the equivalent? So again, going on to apprenticeships, you would need your functional skills, which you sort of answer there really, and then from that, then for each course it would be different. So you would need to go into the route, the profession that you'd be interested in, and exploring what the different routes that you would need. But again, going back to that, is absolutely worth going, thinking about becoming a support worker to begin with. Right, so I've now lost track of the questions as more has come in.
The next one I think is from Lucy. It says, I'm nearly complete my level 4 in health and social. and offered to level 5. Can I do an apprenticeship for an OT while on 5? And will I have to do science? Also, I was looking into nurse associates if there is any webinars for this. Paul, you might be able to come in on there with the nurse associate information.
Yeah, no problem at all. Lucy will have your email address when you're registered for this webinar. We do run similar webinars for nursing associates and midwifery. We've had one a few months ago that I've got the YouTube link, so I can send you that in the email as well.
Yeah, so again, in terms of occupational therapy, just go back to what we were saying before, really, about exploring the support worker entry route into to get onto the apprenticeship, or of course there is the direct degree route into occupational therapy, of which we have a range of universities who do that. So Robin, you've got my work background is support work in various care settings, respite care homes, complex needs day services. Would you recommend a higher band OT apprenticeships, or would it be better start at a band 2 role? I mean, it sounds to me that you've already got a great array of different experiences there. You know that'll give you a really good foundation for going into occupational therapy. Again, we currently do not have direct entry apprenticeships, so it'd be going into the degree, the direct degree route rather than apprenticeship. But then if you could then get into a support worker role, whether that be band 2 or band 3, with your experience, you wouldn't necessarily be band 2 with that experience. You could then explore the OT apprenticeship from there. Right, can school pupils get work experience in a hospital setting? That's a really good question. Alison,
Yeah,
can I hand that one to you?
Yeah, it's interesting actually, because the last meeting that we had, we were discussing the policy, and it's I think it's 15 above age for work experience in the hospital setting. Anyone else on the call remember this conversation we were having? Is it 15 or 16? Because I remember some hospitals are specific and some are they close it off at a certain age.
Thank you, Paul. So Paul's put up some additional information on work experience in the chat, but it'd also be be absolutely worth exploring with your local NHS organisations or other organisations.
Yeah, I'm sure ours is 15 years and above. Yeah.
So
yeah, sorry, Janet, go on.
No, I think that would be one for you anyway, Alison.
Yeah, so this is one we'll get Angela on this one as well.
Yeah, definitely.
Do they still consider us if we pick A-level bio and not A-level physics in doing diagnostic radiography? Yeah, absolutely. I think Angela will obviously come in with this on me, but it's a science. It's a science. So
yeah, definitely they would consider you. And based on the previous message there, we do offer work experience for diagnostic radiography at the Queen Elizabeth in Gateshead. And you do have to be 15, 16, year 11, but we will offer it. But definitely I don't think you will be considered with just having an A-level in biology. Definitely, although you will have to learn quite a bit of physics if you did the course, but I don't think that's going to rule you out at all.
Yeah. Yeah, I came through as a therapeutic radiographer, and it was very similar to getting to the diagnostics, and it was the sciences, but you do learn a lot of physics when you're on site, but it's very applied physics in terms of the machinery and everything like that. So sometimes when people hear physics, they're a bit like, oh, but actually when you apply it to your job, it's actually really interesting. So that shouldn't put you off or anything.
No, it wasn't too. It's not really hard, the physics that you do.
Yeah. It makes sense when you're in a hospital environment, doesn't it? Then maybe it made sense when you were at school.
A lot.
And then there's Andrew. Is there a volunteering route into employment? This is sort of like a direct route from volunteering into employment, but what I would say is that for any of the professions within healthcare, if you have got experience in volunteering in different settings, then that will give you a really good foundation for basing, sort of making your application, going through your interviews, and being able to use your experience from volunteering. So yeah, so I would absolutely advocate volunteering as a way to gain that experience and also to explore what you want to do, because it can be all these different, there's a plethora of professions out there, and it can be very hard to know what you want to do until you've experienced a bit about them. So volunteering is another good route into exploring what you might want to do and be able to then use that to base your applications and interviews on. Any more questions?
I'll just put some more information in the chat just for volunteering and things like that, just so people can click on those links and check things out.
That's brilliant. Thank you, Paul. So, if there's any more questions, what is the step-by-step for going to apprenticeship in diagnostic radiography? Would I go study straight to that field? So Angela?
Angela, yeah.
Yeah, so I would say we don't offer apprenticeships outside of the trust. So it was a bit like Janet said, it's best if you can get in to be a radiology support worker within our department and sort of find out if you do want to be a radiographer, you can work as a support worker, and then when the opportunities come up for apprenticeship, which they are coming up every year at the minute, they're coming up every year. And if you show that willing that you want to do that, you will be offered that apprenticeship, and that will take you to your band 4 assistant practitioner, and then you could progress to be a diagnostic radiographer. You could go back to university through the apprenticeship again, supported by the trust, and that would get you down to your band 5 diagnostic radiographer. So, but we don't take them really from outside straight in. It's about having that background knowledge of what's involved in diagnostic radiography, and you get that as a support worker. Really, you sort of learn what it's about.
Thank you. Thank you, Angela. And Andrew, you have a question there. Have your recruitment strategies changed in recent years? Only in that there's a sort of well documented challenge that we have around our workforce in terms of we need more future allied health professions and nurses and doctors, actually. So we are, feel like we're doing more positive recruitment, if you want, in terms of that we know that we need to increase the workforce in the future, and we could do with yourselves sort of coming through, wanting to do these different professions and supporting you with it. So I think there's probably more support now than there used to be around recruitment, and we're very, we approach it very positively. And a huge opportunities actually at the moment for in all the different professions. So Robin, when can I expect to see September start posts coming out for OT apprenticeships, or have I missed out on this for years? Again, going back to that you would need to be in a support worker role to do the OT apprenticeship, but they do tend to be, there is some OT apprenticeships start in September, but I do believe we do also have some start in January intake. Am I right in that? Are there occupational therapists out there? So but you would need to be getting your apprenticeship via an organisation, but there are, as I understand it, there are the two routes, September or January. Does anyone want to correct me on that, or have I got that right?
Yeah, I think that's right, Janet. I think you check on semi-professions depending on what what organisation, what trust, to
Yeah,
see what's kind of running at the time. But it's definitely
yeah,
increased a lot more when we were talking about that strategy. There's definitely a lot more now than there were. So it's not been years and years of jobs that have gone out. It's very much, you know, getting those posts and workforce planning, really,
yeah.
to get
And I
those
suppose
posts in.
it's also just worth noting that in terms of the future strategy, the future plan for the NHS and the wider health and care system, in terms of developing that workforce. We're saying about the need for more workforce in the future, and there is a big emphasis around apprenticeships, so you will hear more about it as time goes by, because there's an acknowledgement that we do need to be recruiting for all our professions more into apprenticeships. So there will be more information coming out year on year. When do apprenticeships get advertised? Again, that will tend to be through organisations, and that will then be through to their staff group, to the support workers. So that will be an internal advert that would go out for apprenticeships within each of the NHS trusts or local authorities. Local authorities certainly also take on apprenticeships. Right then, so one for our podiatry colleagues. So how long would you work as a support worker in podiatry before you could apply for an apprenticeship?
Thanks, Alison. I don't think there's a set period of time, really. I mean, obviously Claire's story is a bit different, but I mean, the more support you've got, I mean, I'm a podiatry assistant, but I could have applied for the apprenticeship that's just come out. Obviously, I wasn't ready to do that. So really, the more exposure you can get as a support worker, the better in that environment. But I don't think there's a set amount of time. You know, if there's an apprenticeship that's come out, you can easily apply for it.
And what pay band are apprentices?
I think they're going at a band 3. The podiatry, anyway.
Okay, so the advantages of doing a full-time degree compared to an apprenticeship. Does anyone want to take that one? Sure.
I think doing the degree, you obviously go to uni. We don't always have to go to uni, but you would pay the fees to study, and you would do that over 3 years. Whereas with the apprenticeship programme, you are getting paid as a member of staff, and it counts as your years served within that organisation as well. But there's pros and cons of both of them. It all depends on where you're at in your life and kind of what you're looking to achieve and what roles you're in and different things like that. So I did the degree. Apprenticeships weren't really a thing when I did my degree, and I thoroughly enjoyed going off to university, but that's not for everybody. And sometimes people just want to get in on and get paid and work. So it's both routes are equally good. It's all just dependent on individual circumstances, really, and what's available to you and what you want to take on.
And I think in terms of for the sort of doing the full-time degree, it's you obviously don't then need to get a job as a support worker beforehand, so that's sort of more in your control, if you like. So you can just go ahead and explore the different programs and apply for the degree program. So I suppose that would be another advantage of doing a full-time degree, but then you're not getting paid. You know, you have your fees and you aren't getting paid as you're doing it.
I'm just going to make a point about the apprenticeship. So in our organisation, we've had a few where we've had support workers for one profession that have actually gone and done the apprenticeship for another profession, just due to, either changing that career route or knowing that there's a route available or an apprenticeship available. So actually, that's another element. So when you're in a role doing a support working role and you want to change, there is that possibility of picking up an apprenticeship from another AHP profession. So that's just to be aware of as well, because we don't have support workforces for some of the smaller professions. So that's also an avenue or a route people can look at into, just to see what kind of study they want and what opportunities are available to them.
Yeah, and certainly in terms of looking for opportunities for support workers, obviously there's a whole range of organisations who you could go to, across that spectrum of education and local authorities and NHS. For NHS, there's something called NHS Jobs, so you can just Google that and then search on there for AHP support workers, and you can put the filters in for AHPs, and that will bring you up what local opportunities are coming up. So, Andrew, are there plans for a greater range of jobs training through the degree apprenticeship in the future? So, a greater range of jobs. So, in terms of the different professions, I think that the answer of that is yes, in that they are developing apprenticeships all the time. So I think probably now have all the allied health professions now got an apprenticeship route. So we, for example, we just was it last year we started, and there was an apprenticeship route into music, drama and art therapy through Teesside University, and that was a new apprenticeship route that came through fairly recently. So there are plans for a greater range of jobs, and also looking at what the opportunities more system or region wide as well, because some of the smaller professions you have to go a bit further afield to do the study, and they're looking at that in quite a lot of depth at the moment in terms of where there are the opportunities for doing the apprenticeships. Okay, and Cindy, how long does it normally take to achieve a radiography or occupational therapy role? So should we come to Angela or Helen or Caitlin for that one?
No, I'll speak up, that's fine. I would say if you're doing the degree through university, it's a 3-year course for the BSc in radiography. If you're doing the masters, it's 2 years, but that's after you've done whatever degree you've done previously. If you're going through the apprenticeship route, normally a support worker would do the apprenticeship to get to the assistant practitioner band 4 level, and that's about 2 years. And then it's probably about another 18 months or possibly 2 years, depending on when the next course starts, to take you to the band 5 diagnostic radiographer level. So there's sort of 2 different apprenticeship routes you can go to get to the band 5, or whether you want to stop at the assistant practitioner route. Does that answer the question?
Yes, and so Caitlin or Helen, do you want to answer about your occupational therapy?
We were just saying that it kind of depends on how you learn as well. Like, I wasn't a particularly academic person, pleased to be able to do the 2-year accelerated course, which was more placement based. And I suppose the apprenticeship is like a very long placement, isn't it? So if you're more of a kinesthetic learner, then that's much better. I would have done that if I could.
Thank you. And Andrew's got a question of if a sport role experience has been in special school or social care setting, can this be as good as a sport role in the NHS? Yes. So before I became an occupational therapist, I had support roles in both local authority and in I worked in working in the community as support, so within again with local authority, but these days that would be an agency. So yes, absolutely, that can be that is all very relevant. It's working with people essentially.
Janet, just to let you know as well, one of the attendees, I believe it was Helen, had a hand raised. I don't know if she wanted to come in and ask a question, because don't worry if not, Helen, because I know you've lowered your hand now.
I think, was that Helen answering the question about the
about
the routes? Yes. Yeah.
Oh, sorry, my apology.
So Yeah, so and Alison, you said about the NCIC podiatry responding to Stacey's comment about a podiatry present is coming from Plymouth and saying it'd be good to get feedback on how successful this is as opposed to face-to-face study.
What I could do, Alison, if I give you my email, I could maybe get some feedback from Claire, because obviously she's currently doing that. So she'll be able to give us some feedback on how that works. Is that okay? Yeah,
and certainly there are podiatry courses in our system for podiatry, both in oh gosh, my name's just gone out of mode. So in so it's Teesside. Yeah, Teesside has now started a podiatry course, and Durham College. Yeah,
and Sunderland.
And Sunderland, thank you.
We're going to be inundated soon, hopefully, with podiatry.
Excellent, that's good. Great to know that your daughter is interested, Alison. Encourage her, encourage her. Okay. Yeah, I think have we come to the end of the questions? So thank you very much for all those questions. That's been a really good really good level of engagement. So thank you very much for asking all those questions and your interest in our different professions. And just to say that we will be repeating the webinar for other allied health professions. Has anyone on the call got the dates and to hand? I think we do have a webinar scheduled for, is it May and June and September, and on each of those we will showcase another 3 of the allied health professions.
The 15th of May, Janet.
15th of May, thank you, Emily. So we'll make sure that we get that information out as well. So if you're interested in any of the other allied health professions, the whole range, across from physiotherapy to speech language therapy, dietetics, therapeutic radiography, the world's your oyster when it comes to the allied health professions.